311. 3, 2, 1. Skinny old cats, I can relate. We've got one. Sandy Boots Kramer. Good morning, Doc Sailor.
Yeah, morning, Chuck. Yeah, matter of fact, this particular, every once in a while I tell you things we talk about come from real life, and
this is real life.
And this is was inspired by your cat.
We had a scare, didn't we?
Yeah. Well, and the topic today is skinny old cats. Right. And one of the things we run into when you go to conference, there was actually, and I took the topic of this one because I went to the conference and there was one whole talk called Skinny Old Cats, and it talked about the disease challenges that face older cats. Now, one of the things that was interesting in this talk is that when we look at dogs, their metabolism tends to wind down, kind of like ours does as we go. Cats, that doesn't appear to be the case. And so for the longest time we thought that these cats are getting skinnier and older. It's because their metabolism's winding down. And that's not true. That's not true. And a lot of these cats actually have what we call subclinical disease. Now, for instance, like with Sandy, we ran one test, a little benchtop test, that triggered us doing further diagnostics called an FPL. And that told us that the pancreas is in trouble. That raises a red flag because we know that when that happens, that one of three things is going wrong. Either liver, pancreas, or intestines. Okay, and what happens, and the other thing too is all three of them can go haywire. Yeah. And so these are manageable, treatable diseases. And so the take-home message of this talk, just like with Sandy, is if you've got a cat that's losing weight and getting skinny, it's probably not because they're getting old. There's something going on. There's a reason. Because if you think about it, if cats lay around their entire life anyway, they shouldn't be really changing in body condition, then there's usually something. So if you do have one of those skinny cats, ask your vet to go ahead and do some deep diagnostics, and be prepared too. They may actually have to go in surgically and take some samples in the intestines, because some of these diagnoses are only made by getting little bits of tissue and sending them off to the pathologist.
And hopefully you'll have a good outcome. We'll be back right after this.